Good morning, good afternoon, good evening. Welcome to Modern Profession. Yesterday we talked about women beauty. Today is going to about women health. As you know, for the past few years, few days, you can see decline of women health. Either they are on medication, either they have pills, or they are using therapy and so on and so forth. We can go dive into it as you can see a day forward, and we're gonna see it's about Good Morning America. They're gonna talk about it, and we're gonna see what they say.
Dr. Jen Ashton, of course, here with a look at your medical question that you've been asking about. So let's look at the question here. What exercises are okay to do if I have a herniated disc?
Okay, so mini med school, first of all, what is a herniated disc? If you think of, a burger, a really fat burger, when you go to squeeze it and take your first bite, how everything kind of shoots out the back, that's basically what a herniated disc is. You have a lot of gelatinous material that gets compressed between two vertebrae, and it causes a lot of pain. The most important thing is if something hurts, do not do it. And you should always check with a health.
And also, hernia is a lot of women has it because of they don't go usually to number two. So basically, they have that, and the easiest way to help that is also drink a lot of water and also exercise and also drink prune juice and so on and so forth. That's gonna help you push the extra food that's being wasted, so you don't have to hold it in your intestine. And also the disc also compressed, you can feel it. For example, when you go to bed, you can feel it when doing a movement, and then something like that when you're running. Sometimes it's gonna take time, and but after a while, if you do home remedy also, they might help also to clean out the intestine, the gut, so basically you will feel less for it. And then sometimes you hurt it, if it hurts, so all you gotta do is sometimes you push it before go to the doctor, and also they have a surgery for that. So this is what you need to be aware of when you're this, and many people can testify about that as well. And then if you have a follow-up, and then go to your doctor, and then you can see what's going
Care
on.
provider, a physical therapist to make sure that you're not doing harm, obviously, but anything that can help strengthen the muscles around that area, reduce inflammation, increase flexibility is going to be good.
Now I can't stop thinking about my
Well, about that, most women don't exercise usually. There's two kind of women right now about that. This is one that exercise, like they believe in exercise. So that what they do, they exercise a lot. So this is the woman that's been promiscuous. They're doing one night stand, and then they're doing whatever not. They have with F boy, and then they having with Pookie and Ray every time. But also there's the other female, the woman that's barely exercise. What they do, they eat, and then what they do, they are doing all the activities, go to work, and sometimes they are being lazy. That's one point. So those two gonna be very hard for you to understand. Most people that don't exercise, they already feel, they most likely feel that kind of a hernia because of excess food on their guts and their intestine. And more people that exercise, they less feel like it, and it does those who do women that's become promiscuous. So either way, it's a low situation for men, because if she has hernia, there's some position she cannot take, and then also she's gonna be in a lot of pain. Next thing, they're gonna be like sex for you. But if it is for she's relaxed and she can hernia, she's not gonna feel it most likely. But the point of the matter is, if you're in a relationship with her, she's not gonna give you the time of the day. She most likely gonna hang out with the girls, and still working, and also give it to Pookie and Rere and one night stand and all that. So basically, it's a little situation for men, even in the diseases. So women, it tendency that to take for the worst, to accept her for the worst, and then when she feel good, she to ditch you and then give her best life or best health or best self to the street. And next thing you know, when she feel decline either in health or either on looks, this is when she want to push the nice guy to make her feel better. And when she get that dopamine hit, and then she gonna go back again to the street. So regardless if she feel better or not, this is the point that's men making right now.
spine as just a set of cheeseburgers all over the place.
Or a bagel with cream cheese when everything, yeah, that's the medical explanation.
What is your prescription for wellness
Okay, it
today?
has to do for in honor of Women's History Month, some screening tests that women should talk to their healthcare provider about. Very, very important for overall health and wellness and disease prevention. First of all, for cervical cancer, a pap smear, generally every 3 years, if they've all been normal. Any abnormality requires a shorter term, more frequent follow-up. Screening mammography.
um Talk about those are tests that women supposed to do. Not only you're not supposed to wait for those 2 years. If you find, for example, there's a lump, if you find something abnormal in your round body, you should always check a doctor, because those are the best advice. You don't know, sometimes probably stress, sometimes also probably some disease that's slowly growing up. So regardless, you don't have to wait for 2 years, 3 years, but also you gotta go for the checkup, yes, but you gotta check every time you feel something. And women also do that a lot. They go to the doctor because they are aware of their health. They say because they rely on their health because for the bad boy to perform and then to the all this position. But also men don't do that. The reason men don't do that because they don't trust on the healthcare, because they are busy with work, they're busy with daily routine, so they don't focus on their health. Most likely, I advise men to do so. But women pay attention to that because they know that they have to be healthy in order to for the sisterhood to approve them, so they can be a bad girl, so they can go to the club and have fun, because they know if she's sick she cannot do those things, and but if she's healthy she can have the roster, and then she can have many guys that she want. And women want to be promiscuous. That's the reason they love to go to doctor. So basically pay attention to that.
Mammography for breast cancer, according to the U.S. Preventive Service Task Force, every 2 years. That's for an average risk woman. Other cancer organizations have different screening recommendations for that. And then bone density. This is done with a DEXA test, not painful, once at or after the age of 65 for most people.
Right. Dr. Jen, thank you. You can always submit your health and wellness questions to us here at ABCGMA.
So basically, another way women, men take care of your health. The health is a power. Your health is everything. Your health is wealth. So basically, if you find something is not normal, so basically go to the doctor. And then if you have some family that have disease, for example, cancer, for example, diabetes, cholesterol, there's a home remedy you can do that. You should always put yourself a diet, because it's always protect your health, and also its longevity, and also for your family be longer, be around longer, and people will appreciate that, and people will love you for it. But if you haven't do such, I advise you to do so, because you don't ever know, life is short, and then you don't want to be waiting for the last time. I remember one person that was sick, and then she felt like she didn't feel it for a couple of months, couple of years, and then when she go to the hospital, they told her that she has a stage 4 cancer, and then they tell her that she cannot eat, she cannot drink, because if she try to do that, she gonna vomit it, and there's nothing the doctor can do. And then the reason why she ended up at the hospital, because she had a lot of, I think she fainted, and then she got a lot of pain, and then when they bring her to the hospital, it's already too late. So basically, she passed about a week or 2 weeks without eating, and after that she passed away, unfortunately. So basically, this is what happened. She go to the doctor, check her health, but women or that are healthy, they use that as a tool to go to the street and have their best life. And next thing you know, when they get sick, they expect you to take care of them. But at the meantime, guess what? If you're sick, she rejected you, and then she put you on the side, and then you become friend zone, so on and so forth. She's gonna use it for your money, because nothing you can do, and she know already that there's a lot of things you can provide her, and then next thing you know, people can really can have fun. It's a little situation for her, for a man. If she's healthy, she's gonna give it to the street. If she's sick, she's gonna stick on the good man to take care of them for over, and then if she feel better, she can go back to the street. So regardless what men do, you're gonna be dumb if you do, you're dumb if you don't. And if you like my video, thumbs up, subscribe, and that's this one.
What is your profession?